What is diabetic retinopathy? Diabetic retinopathy is an eye condition that can cause vision loss and blindness in people who have diabetes. What is diabetic macular edema, DME? DME is a complication of diabetic retinopathy that causes blurry central vision as well as vision distortion. How common are diabetic retinopathy and DME? Anyone who has diabetes can develop diabetic retinopathy. In India, approximately 1 in 5 people living with diabetes have some degree of diabetic retinopathy. Over time, about 1 in 15 people with diabetes will develop DME. How does diabetic retinopathy and DME occur? Prolonged diabetes can damage the tiny blood vessels in the retina, the light-sensitive layer of tissue in the back of your eye. This is known as diabetic retinopathy. These damaged blood vessels may leak blood or other fluid into the eye. This leaking fluid can cause the central part of the retina, called the macula, to swell, leading to macular edema. When macula is swollen, it does not work properly. This may result in vision loss. What increases the risk of DME? All people with type 1 or type 2 diabetes are at risk of DME. The risk of DME is higher in patients with poor glucose control over a long time. Increased duration of time living with diabetes, high blood pressure, and high cholesterol levels in the blood. What are the symptoms of DME? The symptoms of diabetic retinopathy and DME include blurry or wavy vision, color that appear faded or washed away, and spots or dark strings floating in the vision. How DME is diagnosed? If DME is suspected, you might have visual acuity testing to check for vision loss, fluorescein angiography to look at the blood vessels in your retina, and optical coherence tomography to look at the thickness of different layers in your retina. How to prevent diabetic retinopathy? To prevent diabetic retinopathy and its progression to DME, make healthy eating and physical activity part of your daily routine. Take medications regularly and maintain your blood glucose levels. Keep your blood pressure and cholesterol under control. Quit smoking and get a dilated eye exam at least once a year for early detection of any signs and symptoms. How diabetic retinopathy and DME is treated? In the early stages of diabetic retinopathy, your eye doctor will probably just keep track of how your eyes are doing. Some people with diabetic retinopathy may need a comprehensive dilated eye exam as often as every 2 to 4 months. In later stages, it is important to start treatment right away, especially if you have changes in your vision. It is important to take steps to control your diabetes, blood pressure, and cholesterol. Treatment will halt the worsening of your vision. Treatment with anti-VEGF drugs can slow down or reverse diabetic retinopathy. Most people who get anti-VEGF injections will need injections once a month for at least the first 3 months. To reduce swelling in your retina, eye doctors can use lasers to make the blood vessels shrink and stop leaking. If your retina is bleeding a lot or you have a lot of scars in your eye doctor may recommend a type of surgery called a vitrectomy. Control your glucose and blood pressure levels and get your dilated eye exams regularly. Take anti-VEGF injections at regular intervals to prevent vision loss.